Good morning. I'm really thrilled to be here. Thank you so much for the invitation. I really want to share, I am the co-director of Caring Across Generations, which I'll talk about in a moment. But as Jerry mentioned, this issue is so personal for me because I'm also a working family caregiver in the sandwich generation. So I'm a caregiver to my parents, specifically my father who has Alzheimer's and lives with me. And I have a daughter who's 8 years old. And so I definitely, hence the sandwich generation label. And often my husband and I describe it as the panini generation model because you really feel squeezed between the care needs of both ends of the spectrum, let alone our own care needs. So this is very personal, and I'm happy to be here. Caring Across Generations is a national movement of families, caregivers, people with disabilities, and aging Americans working to transform the way we care in America so that all families have affordable and accessible care options to ensure that our loved ones can age with dignity. So I am going to talk a little bit about the advocacy work that we're doing. Our goal is to build a care infrastructure that we desperately need in this country, which includes access to quality, dignified, affordable care options and choices for families and individuals, more supports for families, really recognizing the growing caregiving responsibilities for many, and millions more quality caregiving jobs with adequate training, living wages, and benefits. So just to talk a little bit, I'm not going to spend a lot of time on the background because a lot of it has already been shared. But just to say, we are in a moment where our care and caregiving needs are absolutely growing and exploding. So we know in this room we're in the midst of an unprecedented elder boom. Right now, aging adults have, with their stagnant incomes and diminished savings, are no match for the longer lifespans, the rising costs of treating chronic and serious medical conditions, and addressing long-term care needs. We know now more than ever we need more elder care. We also know that we're in a moment when the first wave of millennials are having children at a rate of 4 million babies born per year. So we have 4 million aging adults reaching retirement age and 4 million babies who are born a year. And what we're finding is they will need more childcare. And our system for supporting family caregiving as a whole, from childcare to long-term care, is broken. Almost 2 decades into the new millennium, we still have a system of caregiving that was built during a time when the economy functioned on a presumption of women's unpaid care in the home. This is no longer our reality. More women are in the workforce. And so the burden of care is falling heavily on family members, and in particular, people like me in the sandwich generation caught between the demands of childcare and elder care. Like my family, about half the workforce expects to be providing care for elders in the next 5 years. And we do not have the systems in place to support that. Everything from what Courtney just talked about in terms of paid leave policies, let alone if you're a low-wage worker and you have unpredictable schedules, to be able to actually plan and budget for these needs are highly impossible. So the cost of care is outrageous for seniors and people with disabilities and families overall. Right now, the way most people afford the supports and services they need to age at home is through a patchwork that includes exhausting their personal resources, relying on friends and families members, and mostly through Medicaid, which we know Medicaid was never intended to be a program for long-term care. Yet it's become the default way most Americans can afford long-term care, including home and community-based services. So many people are spending down their assets to access the care that they need. So I want to do the math. I want to do the math for a moment. Sorry. Let me go back. Okay. Let me do the math for a second. 75% of our workforce in America earns less than $50,000 per year. I'm just going to say that again. 75% of our workforce in America earns less than $50,000 a year. And the average cost of childcare is over $20,000 per year. The average cost of a private room in a nursing home is between $80,000 to $100,000 per year. The numbers just don't add up. People can't afford the cost of care. And yet our care needs are exploding. And family caregivers like me are being pulled to care for an aging parent while caring for a child. The very population our system relies on to supplement the care for our aging loved ones is already being squeezed by so many economic factors. So in addition to the affordability issues, we do not have the paid workforce we need to meet the growing care needs. The demand for direct care workers will outpace the combined demand for fast food workers, retail salespeople, teachers, police, and firefighters. And I want to say the paid workforce is another backbone of the care system that we're talking about that we need today. Home care workers are some of the most vulnerable workers in our nation. Majority of them are women, people of color, and immigrants. In fact, my co-director, Ai-jen Poo, is not here because she's at the border right now dealing with the broader issues of immigration and family separation. They are making poverty wages, on average about $13,000 a year. 30% of them rely on public assistance programs for food security. They're lacking benefits like health care, so they depend on Medicaid, and they can't meet their own care needs as daughters, mothers, grandparents, or aging adults themselves. They have been excluded from most labor protections in this country that all other working people take for granted. So with the demand growing for care, we need to take seriously how we're going to grow and strengthen this workforce, because we believe care jobs are the future. They are the jobs of the future, with 30% growth by 2030. We have an opportunity now to invest in a better paid, better skilled direct care workforce with lower turnover, all of which will improve the quality of life for our elders while simultaneously reducing costs. This is an incredibly undervalued workforce, and when we get into discussion, I'd love to talk about that some more. I will talk a little bit about the advocacy very quickly. As we started talking about elder care in states, families would then bring up the issues of childcare and paid leave to us. And we realized that really families are trying to deal with a very holistic issue of care. And so that led us to imagine what a policy vehicle could look like that is portable and universally accessible, that helps families afford childcare, elder care, and paid family leave. Everything you need to work and care for your families too. So our big, bold idea that we've been advocating for is one insurance program that everyone contributes to, that everyone can benefit from, that helps people afford care and allows for an infusion of money into our care systems to support professionalizing and stabilizing the care workforce. And while we're working to achieve this at the federal level, states are really on the front lines and are ultimately responding to the rapidly aging population and the needs of caregivers. So we're investing in some pretty groundbreaking campaigns. So again, happy to talk more in discussion about any of these. But in Maine, we're going to win a ballot initiative in November that will create the first state-level universal home care program that all families would be eligible for. This new program would be overseen by a trust fund comprised of caregivers and care recipients, putting what we call the caring majority, those directly impacted by the care system, in charge of decisions about benefits, workforce, and other aspects associated with the program. We also know not all states will launch into universal family care or universal home care, so there's a lot of other efforts underway. So in Hawaii last year, we won the Kapuna Caregiver Program, which is a financial benefit of $70 a day to working family caregivers. And this was really an effort to address the issue that Courtney and Richard both talked about, but about women, often women leaving the workforce, or caregivers having to choose between remaining in the workforce or being able to and care for their loved ones. We're doing a similar effort in Washington State with the Long-Term Care Trust Act that we're really hopeful of passing next year. And then I would just say there's a lot of study bills that are underway in states like California, Illinois, and Michigan to really assess the long-term care needs in states, the needs around the workforce and other types of needs that we're excited about moving forward. So I'll just end by saying that my takeaways here are that we need more affordable and accessible care options for individuals and families. We have to take seriously the kind of supports that family caregivers need and want. And thirdly, we have to think seriously about the paid workforce. We can no longer talk in these spaces and not acknowledge the need for a paid direct care workforce in this country. And all of this ultimately is about a broader, comprehensive approach to the care system, which is why we need more bold ideas like universal family care and other ideas in the world. Thank you.